Today's workshop is Health Literacy, Making Communication More Understandable and Accessible. I'm excited to introduce you to Chrissy Keating, the UVM Health Network Health Literacy Specialist. Chrissy has worked in community health improvement at the UVM Health Network for over 11 years. In her role as Health Literacy Specialist, Chrissy works with departments across the network as a consultant on projects and initiatives to make sure communication is accessible and inclusive to our patient population. Thank you all so much for joining us today. Welcome, Chrissy, and thank you for being here.
Thank you very much, Diane. I am really happy to be here today to talk about health literacy. I have been on the website and you all do so much, and I'm not sure how you have enough hours in the day to do all that you do. So thank you for taking the time out of your day to be here to talk about what I think is a very important piece of the health equity puzzle. So as Diane mentioned, my name is Chrissy Keating, and I'm the Health Literacy Specialist for the UVM Health Network. And a large part of my job is connecting with community partners like yourselves, as well as patients, in order to discuss ways that we can improve health-related communication across UVM Health Network. So today, I really want to talk. I want this to be a very open conversation. You can share your experiences through your personal story, and I also hope that, through these discussions, it will lead to better communication and ultimately better health outcomes, not only for ourselves, but for family and friends. And I want this presentation to be interactive. Instead of having just me being a talking person at you, I want to engage as much as possible. So I believe Diane is going to be reviewing and monitoring the chat. So if you have questions during the presentation, please put them there. And then we also will have lots of time at the end for questions and discussions about what's working well and what we could do to improve the system. So next slide. So this is what I would really like to cover today. It's basically an overview of health literacy. I won't get into too many specifics, but I'm happy to do that at another time if people are interested. But it's really an overview of health literacy and how it impacts our health. And by the end of the presentation, I'd like for all of you to be able to define health literacy, understand the intersection of health literacy and health equity, and be able to name a few barriers to accessible communication, which I'm sure that will not be hard, but maybe it will be. That would be exciting. And also to leave with strategies and tips to implement, as well as advocate for accessible communication. Next slide. So before we get started, I wanted to get a baseline idea of where people are right now and their understanding of health literacy, and it helps me, it'll help me to guide this conversation and really see what areas that I should highlight, or maybe we want to dive into a different level of discussion. But here's the question, and Diane, I hope this isn't going to be too much on you, but just to monitor the chat and see which letter people indicate. So my question to all of you is, what is your level of comfort in understanding and using health literacy principles? So for example, using plain language, teach back, and or creating accessible materials and content. So if you feel very confident in your abilities to understand and use health literacy principles, you can choose A. If you understand the principles, but you're not always comfortable or confident putting them into practice, you can put in the chat B. And if you don't know much about it, great. that's what we're here to do and to learn more. So you can indicate with the letter C if you don't know much about it. So I can, Diane, if you wouldn't mind letting me
Yeah.
know sort of where people are.
So we've got 4 responses
Okay.
and we've got 2 Cs and 2 Bs.
All right. Excellent. That's where I hoped that everyone would be, because otherwise we would we'd all be out there doing the hard work here. But I'm glad that we're all here and we're all going to be learning learning some new things together, and I will be learning from you as well. Okay. So next slide. So I'm going to begin with the definition of health literacy, and this is the definition as created by Healthy People 2020. And a little bit of background on health literacy. You know, we all talk about it, or it's part of what we do. We just don't know to name it health literacy. So anytime that you've been to the doctor, and they've said something to you that you haven't quite understood, you know, that is health literacy. And for the longest time, you know, really until recently, that health literacy piece and understanding health information has really been the responsibility of the person receiving the information. So, you know, when you go to the doctor or you're watching a commercial or, you know, for a drug medication, you know, there's a lot of information there. And it's a lot of information that's kind of thrown at you. And then, you know, at the end, if you're lucky, you know, your doctor would say, "Do you have any questions?" And you know, there's probably, if you're like me, there was a lot swimming around in your mind. There's a lot that you went over. And a lot of times you sit there and you say, "No, I don't have any questions." And then as soon as you walk out the door, there's like a million and one questions that are going through your mind. So, and it was really, you know, until recently, the responsibility of the patient or the person to really do the research and to try to understand what was said to them. So that has changed recently. I mean, and as far as recently really as like the 2000s, and especially 2020, when health literacy became a very important component of the communication strategies from you know, the WHO and other organizations like that. So when we're looking at health literacy, there are 2 types of health literacy now, and it's not just on the person anymore. But personal health literacy is a degree to which an individual has the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And then when you talk about organizational health literacy, that is the degree to which organizations equitably enable individuals to find, understand, and use information. So when you think about, if someone just after this presentation says, "What is health literacy?" Just say it is the ability to find, understand, and use information. And it's the responsibility, it's my responsibility, and it's the organization or the, you know, the provider's responsibility to ensure that I understand that information. Next slide. And when we talk about health literacy, there are different components, and these are just a few of the components that that I'm going to highlight, but there are several more. And when we talk about this, you know, we're thinking about literacy levels, language and cultural barriers, disabilities. Though all of those can impact the way that we understand and use health information. And in addition to that, when you are in a hospital setting or you're in a clinic, you know, there's a lot of stress. There's a lot of emotions. There's might be some anxiety, some sleepless nights where you are just not thinking clearly and you're not at your best. And that also has an effect on how we understand and process information. So all of those components are part of health literacy. And, you know, all like those things like the language barriers, whether it's, literacy levels or language barriers, that all affects your ability to understand, and it affects your ability to understand numbers. So when people start talking about percentages, if you have a diagnosis, or or you're even talking about medication and how many milligrams or how many spoonfuls, to take. So it affects your ability to understand and use numbers, which is also known as numeracy. But then also, when you look at it, it's reading skills, it's speaking skills, it's writing skills. It's the ability to understand really what is being said. And one also new and sort of, for me, it was surprising to know that health literacy also encompasses physical space and accommodations. So those are also things to keep in mind when talking about health literacy. Next slide. So when we combine all these components of health literacy, we can really start to think about what effective communication really looks like. And so I want you to think about your own experience as a patient, as a family member, as a community member. Has health information been shared with you in these particular ways? So when we think about effective communication, we want it to be an interaction. And for Vermont Family Network, it's interaction with families that allow for everyone to share and understand information in ways that work best for them. And you want each person to also have access to resources that best meet and support their communication needs. And then we want this information to reflect culture and be inclusive. And we want to ensure that language access needs are being met. So if there's a need for an interpreter, that those services are readily available for folks who need it when they need it. And I'm just curious, how many, in thinking about those 4 pieces, how many of you experience all 4 of those at a given time? You can think about it. You don't have to answer, but it's just something to think about. All right, next slide. So when we think about health literacy, I want it to be more of a part that we all need to participate in. So we all play a role in improving communication for more equitable health outcomes. And when we look at the definition of health equity, it's defined as the state in which everyone has a fair and just opportunity to attain their highest level of health. And so, as I said before, health literacy is really just one piece of the larger health equity puzzle, but it is an important piece, especially when it comes to communication. And as we talked about before, like, you can't really tell someone's literacy level by just looking at them. And if we are going to make any assumptions or have any biases at all in this work, we should assume that everyone is going to need a little extra help in understanding and navigating the healthcare system, because it's very complex, even for me, who I've worked in healthcare for 11 years. And there are still times where I need some help navigating the system. So accessible communication really should not be a nice thing to have, like an add-on. It really is a must thing to have in order for communication to be more understandable, inclusive, and really usable. Next slide. So with all that being said, there are certainly plenty of barriers to accessible communication in this current system that we have. And these are just a few of the barriers that I've heard about through discussions with patient and family advisors at UVM Medical Center and the Children's Hospital, and also listening sessions with community members. And a lot of these, I'm sure, resonate with you too. So some of them are time. So when you think about not enough time in medical visits or other visits that you participate in, and especially, coming from the medical field, I'll focus on that. But we are given only a minute period of time to address potentially multiple concerns that we have. And so it adds stress to the situation. You want to make sure that you have enough time to talk to your doctor about the things that are really important to you. So we really need to address the timing of medical visits and asking for more time. And this also rings true, like Diane and I were talking before everyone hopped on, that when thinking about websites, and we were talking patient portals specifically, and whether or not they are truly accessible, and what we could do to improve patient portals. But when you think about forms, and especially if you had to complete a form online, sometimes they have a time frame before they time out. And so, just things like that make a barrier for folks when interacting with the medical system. We also have talked about lack of engagement and inclusion, and this is where raising the voice of community members and patient and family advisors are very important. I don't know what I would do in my work if I didn't connect many times a week with our patient and family advisors. We want to talk about accessible formats. So thinking about complex medical forms, websites, and like I said, patient portals, making those more accessible, and hearing the patient voice in that in order to make those things better. We talk about workflows, medical jargon that's used, supports and accommodations. So there's a lot of work that we could do within our organization to simplify those workflows, use plain language, and then document what supports and accommodations are needed for appointments, so that when people show up for their appointments, it runs smoothly. And then lastly, like people's bias, stigma associated with certain conditions, stereotypes, and discrimination also add a layer of barriers to accessible communication. Next slide. And these barriers can lead to negative outcomes. And some of these that are listed here, I'm sure are not going to come as a surprise to anyone, but if someone doesn't understand their medical condition, or if there's not great communication between the patient and the provider, it can lead to dissatisfaction for both the patient and the provider. So, some of these, you don't always think of communication leading to poor outcomes, but it does lead to poor health outcomes because people don't understand how to take care of their own health, or there are many other barriers out there that are preventing them from having access to good health. And miscommunication can also lead to delay or people avoiding seeking care, a misdiagnosis, or a late diagnosis, meaning getting diagnosed later in the progress of the disease. And had people known ahead of time, they may have been diagnosed sooner. A lot of times that patients are deemed non-compliant, and I'm happy to report that term is slowly going away, which I'm very happy about, because it just shows a lack of curiosity from the medical standpoint. And there's probably so many reasons why a person didn't show up to their appointment, or was not taking their medications correctly. And it's not just on the the person. It's on the medical team as well. And, all of this, as far as communication goes, is preventable. So, I really want to highlight that a lot of this, especially when it comes to miscommunication, these were preventable events. All right, next slide. So, what can we do to incorporate health literacy into our work? So, next slide. I have found the American Speech Language Hearing Association, and they are a really great resource. So on their website, I found this really great acronym that I wanted to share. And I think it will be helpful from both perspectives, both like the family, the patient perspective, and then also the provider or the medical perspective as well. But it's this nice acronym, which is perfect that it's access, because that's what's most important. And it's easy to remember. So the first A is ask about communication preferences. And that's more on the medical provider side. So if you are not being asked what your preferences are, it would be a good time to communicate that to them and say, hey, have you ever thought about asking what my preferences are? It's a great conversation starter, and it is something that people need to be aware of, because if they're not asking, then they should be. The C is communicate directly to the person. And this is true for, if there's an interpreter in the room or a caregiver, and you might see the provider or the other person looking at the interpreter or the caregiver to talk about, diagnosis or next steps, but they're more communicating to the interpreter or the caregiver. And so we really want to change that so the provider is looking at the patient when talking, unless otherwise noted. But that is, we want people to be involved in their care, and if they feel like they're getting talked about instead of talked to and participating in their care, then that can be really disheartening, and that's something that needs to that we can work on, and that could change. The next C is check for understanding, and that is mostly under the category of teach back. So asking questions to ensure understanding. So that could be, the patient or caregiver asking lots of questions. So please do not hesitate to ask questions when you need to. We want to make sure that communication is open and that you feel really good about what you've talked about, and there's an understanding there once you leave the appointment. So to check for understanding, and that goes for the provider too. They, instead of just saying, do you have any questions, the provider could ask really specific questions to make sure that they know that the patient understands the plan and like what they've talked about. The E is to ensure that there are limited distractions. So a quiet space, for conversations is always appreciated. Limited distractions like loud noises, crowds, cell phones, things like that. Anything that can be a distraction, try to remove that from the space. Slow down and give time to process. That's pretty self-explanatory. And to me, that's a really important point, is to not rush through things, especially for those who need a little bit more time to process. And it's okay to ask for the person, whoever it is, a provider, whoever it is to just slow down and then give them time to process. And also, a piece of that is not trying to finish people's sentences, not trying to anticipate what the person wants to ask. Just wait. Just give people time to share what it is that they're trying to say. And then the last S is support actions with different communication methods. So that goes along with documenting both best modes of communication. So if anyone has an electronic medical record, there are areas in there that they can put notes of, and that can be flagged, of what the preferences are. Okay, next slide. So strategies for better communication. And I put together this slide, and it has a lot of different things on here, but I tried to break it up as much as I could. But if you're working in an organization, or, as a patient or a family member, these are just things to start looking for when you're given brochures or pamphlets or discharge paperwork, things of that sort. So just kind of look for these things to ensure that there's good communication. But my first recommendation for everyone is to use plain language. And plain language is also known as conversational language. And it's a way of communicating information in a way that is understood the first time you hear it. So you shouldn't have to repeat yourself. You should, and it's hard. It is hard to put things, especially medical terminology, into plain language, but it takes a little bit of time, but people can do it. And it's okay to push, but you want the information to be understood, or try to be understood the first time that they hear it. So it's really how we speak to family, friends, on a daily basis. And if you're writing using plain language, some tips that can be helpful are using bold letters or highlighting key words. And so if you're looking at something and there's just a lot of words on a document, your eyes would go to something that is in bold. And so if you're going to do that, make sure it's the most important information that you want, sort of a takeaway for the person. Drawings, photos, diagrams are really helpful for visual learners. Video, audio recordings for that type of communication. I know that a lot of people are using their cell phones now to record appointments so that they can go back and listen to them later. So, in case they misheard something or missed something, writing it down also is very helpful, but at least if you're recording it, you can kind of be present in the moment, and hopefully you'll be able to ask more questions and the conversation will go better. The thing about that is that you will need to let the person know that they are being recorded. And, but I would say that most providers are okay with that, because that technique is getting used a lot more. Looking at font size and color against background, for those who are have visual impairments or low vision, that's also necessary. So really, ideally, font size is at least at 11 or 12. And that font styles are what's called sans serif, which just is a fancy word for saying like the script. So if things look like cursive, or the letters get a little fancy, you want to try to avoid that, and use pretty plain fonts like Arial or Calibri. Those are very plain, very straightforward, and it's just easier to read. On the teach back side, it is so useful for verbalizing information and ensuring that it's understood. When you do that, chunk information into smaller, what we call bite size, which is the most important information first. So that's going to help the person be able to understand the information better, is if you know, keep it short into smaller bites. It's a little bit more digestible for folks. And stories are also a really great way to share meaningful information. And I think you all do a very good job with that. All right, next slide. So accommodations for better communication. This is another graph that I just put up a lot of different options on there for you to consider when communicating. So it's not just limited to communication, but it's also accessible physical spaces. And this includes providing necessary accommodations and services. And, you know, the current healthcare system needs to do a lot of catching up when it comes to making our spaces more accessible. But in the meantime, people are getting really creative within the current structure. And there's a lot of, you know, great technology and in ways to incorporate accessibility into physical spaces. You can also extend appointment times or offer telehealth visits so that people don't need to leave the comfort of their homes. And that can be really great for those who have anxiety around transportation, or they, you know, it's just such a barrier to get from one physical space to another. So telehealth visits can be very helpful in that space, and especially in the winter in Vermont, when the road conditions can be less than ideal. Telehealth visits can be very helpful in those situations. You know, there's also the fact that we live in Vermont, and access to reliable internet service is not always the best, but that is certainly something that I believe is a priority for our state, especially since COVID, and more people are doing telehealth and telemedicine. If you're in a meeting and it's either a meeting or a Zoom call, you know, whatever it is, using closed captioning, turning that on, or using transcripts to have a record of what was talked about is also really helpful. And for language access, using trained professional interpreters, and that's not only going to ensure that information is interpreted correctly, but it's also going to be understood by the person. And as with all of these strategies and everything that we're talking about here, it is really most important that people are asked, and that medical professionals ask what works best for the person receiving the information. So my mantra in my work is just be curious, just ask questions, ask what's most important to the person. And for those of you who are on the receiving end of information, it is so hard to advocate for yourself, but I think it is very important. Speak up when you don't understand something that was said. Ask someone to repeat it. Ask them, you know, if there's a drawing or a diagram or a website or a YouTube video that they could link you to help you better understand what was talked about. Letting the organization or the hospital system that you're working with, let them know how you want to receive the information, and they should be able to accommodate you. And for those who are creating content, you can go to the next slide. I have this quick health literacy checklist. And, you know, those of you who may not be creating content for education, these are things just to look for when you're given something, to see if it has all the health literacy principles in mind. But, you know, for visually, again, we talked about font size, easy to read font, Any type of heading should be in bold. Leave plenty of white space, which is just blank space in the document, so it doesn't seem so cluttered. Using bullet points is a great way to get the most important information highlighted, but no more, don't put like 25 bullets because then that can get overwhelming too. So use about 7 to 8 per section, per heading or topic. We talked about text color with contrast. That's also very important. With language, using plain language, be concise, try to avoid really long run-on sentences. Providing that most important information first is great. Make it inclusive, person-centered language. And the last piece of this is reading level, because most documents are, especially medical language, is at like a 10th or 11th grade level. And ideally, you could get it down to like a 7th or 8th grade level, which would be, it's better. But it's not, that's the reading level is like one small piece of the larger puzzle, and shouldn't be the end all be all. So if someone says, oh, well, we put this document through a readability calculator and it says that it's at 8th grade reading level, so we've checked that box. It's like, no, there's more to it. That's only one small piece of the larger puzzle. Next slide. So the last thing that I want to leave you with here is I really want to advocate for organizations to assess their health literacy as part of their mission-driven work. And here are a few options for assessing health literacy and really incorporating the patient or family voice in there. So an actual assessment is called the HLE2, which is the Health Literacy Environment of Hospitals and Health Centers. And that was created by Harvard Public Health. And it is a really great assessment. And it is built for healthcare organizations, but the information in there and the assessment can be transferable to other organizations. Because really what it's looking at, it's from a health literacy perspective, it's assessing policies, physical spaces, wayfinding, and communications, and really a lot more. So it's a yes or no checklist where you score your own organization in these different areas. So it's a really great resource. So I highly recommend that. And it's in the resource slide that will be shared later. Also, I encourage organizations to have either a patient education review team or patient and family advisors, or just some type of committee where there is a feedback loop for patients and families to share what's working well within that organization and ways to improve it. And I will say, working with the UVM Medical Center patient and family advisors, I've learned so much from them, and they're really partners in my work. Like I run so much by them before it goes out to the general public. So that, use that patient and family voice to make things better for your organization. And then lastly, language access. So if you aren't connected with a language access service organization, I highly recommend. We have some amazing nonprofit organizations here in the state of Vermont that are dedicated to language access. So, whether it be interpreters or translating material, it is critical in making communication more accessible for those with language barriers. So I am going to pause here, Diane, because I hope that maybe there's some conversations that can happen or some questions that have come up. So I will pause here.
Thank you so much, Chrissy. This was excellent information, very, very helpful. Before we move to the question and answers, I was wondering if we could just take a minute for everyone to complete the survey that will be posted in the chat. This really helps us to make improvements in our workshops and programs, and your feedback is very important to us. It also helps with our grant requirements. So let's just take a moment to do that, and then we will move on to questions. Great. Thanks, everyone. I think we'll start taking questions now. And I'm going to go to the chat first. So let me just get back here a little bit. So this question, we talked a little bit about this. What are some effective strategies for families to use to advocate for their health literacy needs? And what are some changes that you see happening within the medical community to become more equitable in terms of health literacy?
Yeah, that is a really great question. Um, I th Going back to that acronym access, I think that could be a good start. Um, and really just starting to pay attention more, because we can get so like complacent. I don't know if that's the right word, but like, well, this is, or accepting like this is just the system and we have to work within the system. And um, I think in the last couple of years, especially at UVM Medical Center, I've seen a huge push to um of really listening to the patient voice and making changes. And I've actually been very surprised, because it's a huge, the network is huge, but I see a lot of dedication to that, whether it's DEI initiatives, um, and having those conversations at a higher level. So I think what was happening before, when talking about what are some changes that we see happening in the medical community, um, I see more conversations happening about this, and at a leadership level, not just, me as the health literacy coordinator knocking on doors saying, we need to talk about effective and accessible communication and make it inclusive. It's actually, there are conversations at the leadership level of integrating this into communication strategies in the future, and network strategies. So I work out of the community health improvement department, and they also look at what's called the community health needs assessment. And that's a survey that goes out to community members in Chittenden and Grand Isle counties, to look at ways to improve healthcare. And because I am part of that department, and the community health needs assessment is something that is mandatory for us to do, um, it's not just like a nice thing. Like, we do need to do it, and it is important. And we're really involving a lot of community voices in this work, and elevating those voices. So I think that those are changes that I'm seeing. I think people are now acknowledging that um, we could do better when it comes to language access and being inclusive, especially when it comes to um, cultural needs and language needs. And I will say accessibility is, as far as from a disability standpoint, that is something that is now higher up on the radar, really, of the future of UVM Medical Center and really the health network. But there's a lot of attention that is getting paid to that, and in Epic, which is like the electronic medical record, they're trying to do a better job of asking questions and identifying different populations and the needs of people that I don't know if it was documented as well previously, but they're improving that system as well. And but when it comes to strategies for families to advocate, I think there's been so many times where we felt like, well, this is just the way it is. And so don't feel like that's the way it is. Like use your voice when you see something that could be improved. One of the things, at least from UVM Medical Center perspective, is there's a patient and family advocacy department. And so if something went wrong, or really, yeah, I mean, if you were not satisfied with your level of care, you can call that office directly and you can advocate that way. They do have patient advocates, and they'll go in um, and research like what happened. They'll bring it to the table. There will be discussions about it of ways to improve. So that's one way. Satisfaction surveys. I know that surveys can be not the most fun way of communicating, but that's another way to advocate is through surveys. But really, it's having these community conversations and these partnerships that we have, so that we can elevate the voices of the people who don't have that direct line to leadership in these organizations. But so that's another thing when you talk about community councils or patient and family advisors. There are so many different ways that people can be involved and to make change. So, but for those who, their lives are so busy already that they don't have the opportunity to do this advocacy work, elevating it to an organization or, calling the hospital and talking to patient and family experience. Those are just, small ways that people can be involved in just becoming aware of things, because there is an expectation now that healthcare and communication is more accessible. So when you don't see that it is, it's okay to call it out. I don't know if that is helpful.
Okay.
Yeah.
So, Chrissy, I have a question. With things like my chart and patient portals, we talked a little bit about that. Um, Technology might not be as accessible. Do you foresee that sort of more traditional approaches will still be available to people versus kind of logging in and requesting refills or making
Mhm.
appointments? That some traditional ways to approach your doctor's office or appointments will continue to be available for people. And along with that, anything new kind of on deck coming with my chart or patient portals.
Yeah. I will say I I come from like pre-technology days too. So the younger generation, like technology is no issue for them. Like they can navigate that like no problem. But for those of us who, technology wasn't part of our world growing up, there will still be opportunities. Um, I think that they it's tricky because technology can be easier, and it makes the health accessible and when you need it. So, you could log on to your patient portal at any time of day and, look through information, pay a bill, get test results. And, from a personal perspective, like I feel like that is good because that is just sort of meeting people where they are. But living in a rural state, where technology, where the internet is not always reliable, and we're talking about telemedicine too, um, you know, it's not always reliable. And so I think you do have to make space for other ways too, of reaching people where they are and sort of meeting them where they are. And I think that's also part of what should be um, what should be recorded in people's health records is like what their communication preference is and like how do they want to even have access to a patient portal, or if they, if it's someone who's older or needs someone's assistance in completing it, having a proxy, of someone else who can access your health information. So I do think that whatever the preference is of the person, that should be talked about and not just assumed, that everyone's going to go on to or use technology in order to access their health information. And in my what's really coming out, and I'm sure all of you are aware, but using AI too, is certainly it's coming, no matter how you feel about it. I have mixed feelings about it, but it's here. It's just going to become more of a part of how we interact with each other in healthcare and how health information is communicated. And I was sharing with Diane that there's interest of using AI in test results and in interpreting test results for people, especially on your patient portal. So instead of you going on to your patient portal, looking at your test results and then Googling, like, what does that mean? Then there will be like a hospital approved AI system that puts it in plain language so that you can understand. So like all that is getting tested now, and it's very interesting of where that's going to go in the future and how that's going to affect how we communicate with each other. But
Yeah.
but there should always be a place for those who do not want to use technology. And I think it will still be there. It's just, I think technology is becoming more and more part of the healthcare system.
Thanks, Chrissy. Another question in the chat. Um, this person would like to know the consequences of the low literacy on new Americans communities at UVMMC as health literacy specialist.
Yeah, that's a great question, Jules. And it's a very well, it's not only an important question, but it's something that we need to really think about. And so we have a person who is overseeing the language access department at the hospital now, who's doing a really great job. But again, conversations with community partners like Jules is really critical in talking about those consequences and the real life consequences of low literacy. And we need to do better when it comes to translations, using trained interpreters, because literacy is, I mean, it doesn't necessarily need to be like a new American population, but it just really any population too. But just making sure that people really understand the information that's given to them. And specifically with the new American population, we could go down this road. I could talk, about this for a while, but there's a lot of different, pieces of that. There's the culture, there's, the nuance of, French is spoken differently in different parts of the world. So like meeting that person's needs with the appropriate interpreter, with language, with videos. There's an organization called Vermont Language Justice Project that makes videos on various topics, a lot of them health related, some not, some are just like how to pay a bill. And they're translated into about 15 different languages and even ASL. So the more that we can do things like that, I think we're going to better meet the needs of the new American population and, the literacy part. But we really need to dive in with community partners and talk about like how we get there. And these conversations will help us understand better and help us get there to meet the needs of that population.
Thank you. I think we have time for one more question, and I see someone has their hand raised. Cole, do you want to ask your question?
Hi, Joel. Oh, there you go.
Perfect. Thank you, Chrissy, for the excellent presentation. My name is Joel Dorr. I work at the Community Health Center. I'm the DI director here. So the topic that you presented on, Chrissy, is a timely discussion, especially in the work that we do in healthcare. And one of the challenges that we're facing, and by we, I mean those of us in the healthcare, is the issue that Diane talked about, the technology, when we're talking about Portal, when we're talking about NextGen or Epic, right? There are these built-in structures that even when you do your best, you have internal initiatives that are promoting language access. The technology we use can really dictate, it can really limit what we can do to really make that impact. A good example, I think where there's an opportunity, collective opportunity, is to really advocate collectively and send a message to this organization that we use their products, that look, your product is great, but you need to make real step to make sure that your product is accessible to us, the users, and then our client that rely on our service. I think we need to complete that circle. If they can allow us to even select the level of education of a patient, for example, right?
Yeah.
If in our system we can document the levels of education for our patient, that would be huge, right? Because that will allow the provider to talk to that patient at that level of education, right?
Mm-hmm.
Right now, it's not possible, right? And if we at the Community Health Center try to raise that as an issue, we are just one out of others, right? So until we make this collective advocacy to really push them a little bit harder, I think it's going to be challenging. So I don't have a question, but I think that's a comment that I just want to make. So
Yeah.
thank you. Yeah.
Thank you.
Thank you. Yeah, thank you, Joel. I agree. And we've also had conversations too about how, each organization has their own, either an electronic medical record or just, their own system in which they track information, and how like none of that speaks to others. So like where Joel is, like that doesn't always necessarily speak to the UVM Medical Center, EMR or the Epic. And so, you know, there's so many different silos of where this information is getting stored and utilized. And it would be so amazing if we had one collective system, you know, with at least shared some, you know, overlap a little bit, just so that that communication goes a little smoother and is definitely more accessible. And I agree, Joel, like to your point of, you know, meeting people where they are. You know, I've had some advisors that have said, like, I don't need plain language. Like, I don't want to be talked to like a child. And, you know, they sort of miss the point of plain language, but it, you know, that's their perspective. And, you know, and people have different levels of understanding. And so knowing what level of understanding and how people want to engage in their healthcare, like, it's so helpful to know that. And before I let everyone go, I just want to call out, you know, a couple of some new partners in this, and like Jules and Joel and Patrick, and like knowing about the organizations that they are running and that they are part of. I think the more that we can partner with these organizations. So I don't know if people want to share that in a chat of like your name and where you work. But I think that that could be really helpful too in continuing these conversations and these partnerships, because like we can't do it alone. It takes a village for us to do this work. And I'm so happy that all of you are partners in this too, and challenging me.
Chrissy, thank you so much for helping us all learn more about this very important and timely topic. I learned a lot, and I found it very helpful. I just wanted to let folks know, I know we're wrapping up, that we have many more interesting workshops coming up, and you can find the details on the homepage of our website, vermontfamilynetwork.org, along with the links to the previously recorded ones. So if you've missed any workshops, you can find all of those on our YouTube channel. We have tons of information. Getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you're a parent. We have 2 closed Facebook groups, one for parents of children with disabilities and special health needs, and one for those with adult children. You can sign up for our monthly newsletter or check out our YouTube channel. We're here to help. Please contact us by phone or email. Thanks again, everyone, and have a great day. Really appreciate your being with us today. Thank you.
Thank you all so
Thanks,
much. I really
Chrissy.
appreciate it. Thank you. And be in touch, please. You'll see the slides. It'll have my contact information. So please be in touch.
Thank you. Take care, everyone.